The DSM-5. Autism's Diagnostic Framework for Unification and Understanding. The importance of the DSM-5. Published May 18, 2013, the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders 5th edition, DSM-5, consolidated various autism-associated conditions. These conditions included Asperger's syndrome, autistic disorder, childhood disintegrative disorder, pervasive developmental disorder, PDD-NOS, and Rett syndrome, into a single category known as autism spectrum disorder, or ASD. This consolidation aimed to address overlap and reduce confusion in autism diagnosis, streamlining the understanding and classification of the disorder within medical and psychological communities, and it maintains a widely accepted diagnostic framework for defining and understanding autism. The DSM-5's definition of autism. The DSM-5 defines autism as consistent challenges in social communication and interaction across different situations. These challenges include difficulties forming and maintaining relationships, understanding nonverbal communication, and exhibiting repetitive behaviors. Additionally, the criteria in the DSM-5 take into account the age at which symptoms appear and the extent of impairment, while also providing exclusion criteria to differentiate autism from other conditions. Age of onset and impairment, early development and beyond. Autism's diagnostic criteria typically become apparent by early adulthood. However, social communication and interaction deficits often become fully evident when individuals encounter social demands that exceed their capacities, significantly impairing their overall functioning. Specifically, autistic individuals may struggle with adapting to unexpected changes to their routines, effective communication, occupational pursuits, relationships, social interactions, and other crucial areas of daily life. Challenges that can significantly hinder their ability to succeed in educational, professional, and interpersonal contexts. This recognition of the pervasive impact of autism on multiple aspects of life underscores the importance of early identification and tailored support to mitigate challenges and promote optimal functioning. Developing, maintaining, and understanding relationships. Autism's associated challenges and deficits. Autistic individuals experience unique challenges in developing, maintaining, and understanding relationships. Notable difficulties manifest in distinct ways. Specifically, autistic individuals may struggle with naturally adjusting their behavior in social settings to fit social contexts. Additionally, there is often a natural tendency to interpret language and communication in a literal, straightforward manner, which can lead to difficulties comprehending sarcasm, irony, or abstract language. Further barriers arise with social initiation and appropriate response, resulting in deficits when making and maintaining relationships, having a limited social imagination, or understanding others' perspectives, intentions, or emotions. Significantly, these challenges contribute to autistic complexities when forming and navigating relationships. Nonverbal communication behaviors. Autism's associated challenges and deficits. Nonverbal communication behaviors present distinct challenges and deficits for autistic individuals. Notably, autistics may have limited use of gestures, body language, and facial expressions to convey emotions or meaning and may also need help recognizing and interpreting social cues, including body language or subtle social signals. Additionally, autistics may experience challenges with understanding and expressing nonverbal cues, avoid or exhibit unusual eye contact, or have difficulty using eye contact to regulate social interactions. Restricted repetitive behaviors. Autism's associated challenges and deficits. Autistic individuals commonly display distinct behavioral patterns characterized by limitations and repetitions. These behaviors often encompass sensory challenges, manifesting as either hypersensitivity or hyposensitivity to sensory stimuli. These challenges can result in heightened sensitivity or seeking sensory experiences related to specific sounds, textures, or stimuli, significantly affecting their daily functioning. Additionally, autistic individuals frequently exhibit intense fixation on particular interests or activities. Insistence on sameness and repetitive behaviors. Many autistics tend to adhere rigidly to routines or ritualized behaviors, which can make it difficult for them to adapt to changes in their environment. Furthermore, repetitive behaviors, such as hand flapping or rocking, serve as mechanisms for self-regulation or comfort and are common in the autistic community. Social-emotional reciprocity. Autism's associated challenges and deficits. Autism is associated with challenges and deficits in social-emotional reciprocity, which manifests in various ways. Autistic individuals might exhibit unusual emotional expressions or responsiveness, such as limited facial expressions, gestures, or vocal tones, complicating social interactions. Additionally, autistics may find it challenging to take turns in conversations or activities or frequently indulge in repetitive behaviors or interests, hindering their ability to effectively engage in reciprocal social interactions. Certain behaviors, such as limited engagement in conversations, dominating discussions with specific interests or viewpoints, and finding it challenging to contribute appropriately, are typical for autistic individuals. Additionally, autistics may struggle with sharing emotions or interests with others, making it difficult for them to form relationships. These difficulties can lead to a higher likelihood of experiencing social anxiety or discomfort in social situations, which further complicates their ability to connect with others. The DSM-5. Key takeaways. The DSM-5 provides critical insights into autism spectrum disorder, emphasizing its core components of social communication deficits and restricted repetitive behaviors. This framework is instrumental for professionals in diagnosing and comprehending autistic individuals. Crucially, the DSM-5 framework demonstrates empathy towards those navigating autism. By integrating DSM-5 principles, we underscore the importance of promoting inclusivity and acceptance of autism within our communities. This approach highlights the value of acknowledging and embracing the distinct perspectives of autistic individuals.